have our most socially vulnerable. So we did create the index to help identify where vaccine rates might have been the lowest, and also to be able to provide those communities where access might have been harder to reach. Thanks.
Alvina, if I'm repeating because I missed the first question, just
yeah, it's a little noisy.
So I'm curious, once we start adding in the 12 to 15-year-olds, if we were to consider that with, as the full eligible population, obviously we're adding in more numbers on the backside of that too, so I would think our, rate's going to come down, but you also have more people getting vaccinated. So do you think that we should be looking at the number of fully eligible people, or should we stick to that 16 and up to get to that 70%?
Oh, we will be looking at both. So whether or not we should base the next phase or the next rollout on the 16 and up versus the 12 and up. We'll take a look at those numbers. I mean, we will continue to monitor that, and we'll also keep an eye out on the percent positivity, which is also one indicator of the transmission that's happening in our community.
Another question for you. Last week I asked about some of the businesses.
Yes, and I had a whole sheet of points that I forgot to read. So let me get it.
Okay, perfect.
I completely skipped over everything he wanted me to tell you.
That's why I was running the back here saying,
He didn't like wave his hands or anything. Yes, so we have the business mobile vaccination request forms that we had talked about. So we have these small businesses or businesses can get together and sort of apply, essentially, to have a mobile unit come over to their site to help vaccinate those persons on site to make it more accessible, easily accessible, and fit in with their work hours and their schedules. And so there's a form on our website specifically for this kind of application, and we encourage businesses to get together, making it an event, bring in a lot of people, so that we can bring an appropriate and good large amount of vaccine so that we can get more people vaccinated. And so you can go to our website, our Florida Department of Health at Orange County website, and it's www.orange.flhealth.gov.
And so do you know what
What's up?
employees of the business.
Employees of the businesses, yeah. So it's not a, it's...
You don't have to be the owner of the business to request this. Is that what you're saying, or no?
No, he's saying that it's not necessarily like an open pod, like everyone in the community can come to like Rosen Hotel to get their vaccine. It's essentially, it would be considered to be like a closed, what we term a closed pod, which is for that location, and they are partners who have agreed to have this event.
And so has there been a good demand for that? Have you guys heard from a lot of businesses that are requesting this?
So they were just out this morning at the Goodwill on Orange Blossom Trail. So we have had, there's been some good interest. And there's been a lot of businesses who want it. They might be a little bit smaller, and so we're encouraging them to get together with maybe their neighbors, say in a large, like in a strip mall. I don't know what the better word for a strip mall is, but in a shopping center or plaza.
And then my only other question is, you mentioned one of the deaths was August 2020.
Yes.
People always want to know why we see deaths reported so late. So could you just give a little more perspective on why it would take this long to count that as a COVID death?
So it varies as to the reasons why. So one part is there's a state level review, and so another part is jurisdictional. So we mentioned that we had a transfer to out of country, and so we get that happens vice versa. There's also some people may have a protracted course of illness. So there's some of that, and then there's certification of the death. So sometimes that takes a little bit of time. So I don't have a specific reason for this particular one.
I have a question about
Sure.
the positivity. So essentially the way phase 3 is worded right now for Orange County is if we reach, to get to phase 3, it's if we reach 70% or more vaccinated, and or if we see that 2-week 5% rolling positivity rate, it might be more likely that we see the latter first, or it's possible that we might see the latter first, but if that's the case, and we reach that 2-week 5%, but we're not really close to that 70%, do you see it being safe to go ahead and move on with phase 3, or would you like to see, or do both really need to happen?
I mean, safe is a relative term. I think you all have asked me a lot of questions, and my general answer is it depends. And so we would like to, the 5% or less indicator is an indication of how much community spread is happening and how much transmission is happening. And so as we increase or continue to increase the vaccinations, we will increase the community immunity and thus still be able to reduce the number of infections that happen. So we would like to see all of that concurrently happen together. Thanks. Sorry, I'm usually like a hand talker, so.
Thank you.
So
Good question. Thanks.